My name is Tamara Nash. I'm a member of the State Bar of South Dakota Lawyers Assistance Committee. Being an attorney is so stressful, and we tend to absorb that stress into ourselves, and we fail to realize the impact that it has on us and the trauma of the things we see every day, what impact that has on us. So it's important to take a step back and realize that we may need help too, or those around us may need help. And so lawyers assistance programs help us with the tools that we need to educate ourselves and to reach out and be a friend to those in need. Please take a moment to learn more about mental health, substance abuse, and addiction, and how we can live above the bar.
Hello, I'm Pamela Ryder. I'm president of the State Bar of South Dakota, and joining me today is Dr. Singh from Sanford Psychiatry. Welcome to the State Bar's Lawyers Assistance Committee's Living Above the Bar series, where we will discuss a variety of health-related topics that impact us both professionally and personally. During this segment, we will discuss with Dr. Singh the signs, symptoms, and treatment for depression. But first, Dr. Singh, thank you for joining us today.
Thank you for inviting me.
Yes. As I mentioned, we'll talk about depression. Sure. And to start, would you first discuss with us some of the underlying causes of depression?
So depression is a very biological disease. We really need to understand the difference between somebody just feeling down and being clinically depressed. When we start looking at depression, we need to start looking at that in terms of an illness, that we are looking at a mental health issue that is an illness. And the underlying issue is a dysfunction of certain neurotransmitters in the brain. And it could be serotonin related, it could be norepinephrine related, it could be dopamine, or an interplay of any of these neurotransmitters that leads to the symptom complex of depression. It's a very complex disease process. So what we have to understand is it is not a dysfunction of one particular thing in the brain. It is the genetics and the environment coming together leading to this syndrome of symptoms that the patient presents with.
And if a person thinks that they may have depression, what are some of the signs and symptoms that they could watch for?
The most common signs and symptoms would involve this feeling of sadness and hopelessness, a sense of worthlessness that comes along with symptoms of depression. Now, once again, when you see symptoms of depression, you will call it clinical depression when it starts to interfere with an individual's life. It will cause some occupational problems for them. It will start causing personal problems for them. Friends and family members will notice that this individual is a lot more withdrawn. They're not as interactive. Their work productivity will go down. Their interaction with their families will go down. They'll tend to either sleep excessively or have difficulty sleeping. It could be either or any parts of these spectrums. So you will notice a change in their eating habits. They either might be eating excessively or they might notice a drop in their weight because they're not hungry at all. So you will see all these neurovegetative symptoms along with the feelings of hopelessness, sadness. And if this complex continues to be there for a period of time, it could lead to individuals having suicidal thoughts also.
And I understand that there are different types of depression. Will you please share with us what those different types of depression are?
So clinically, from a clinical standpoint, there is a form of chronic low-grade depression that we tend to see, which is called dysthymia. Individuals with dysthymia are able to function, but they're not functioning at their full capacity. They're able to get to work, they're able to interact with family, but they're not functioning at the level they are capable of functioning. This is chronic low-grade depression, and individuals with dysthymia-like conditions need to go and talk to their physicians about maybe starting an antidepressant, but more importantly, also go and see somebody for counseling. Dysthymia tends to respond better with psychological interventions like counseling and therapy, so I would very, very strongly encourage if somebody suspects that they have this low-grade depression, that they go talk to their physician or talk to the physician about getting into counseling. The next form of depression is what we clinically call major depressive disorder, which is the more severe form of depression where individuals are more incapacitated by the symptoms of depression. And in these scenarios, you will see that the patient is more impaired. They might be calling in sick, they might not be coming to work. as I said earlier, the productivity might go down. So this is the more severe form of depression. When you break down this clinical depression, other variants of this clinical depression could include what we call atypical depression. Atypical depression is a form of depression that tends to occur in people more so this time of the year, in fall and winter months. This is a form of depression that patients will notice. They will come in with symptoms of sleeping more, eating more, having low energy, feeling more tired, more exhausted all the time. And we usually see this form of depression with seasonal affective disorder. So that is another form of depression we need to be very cognizant of. In females, we also need to be very cognizant of the fact of postpartum depression. So if you have young mothers who just had a baby, and it is normal for mothers to go through a period of some postpartum blues. That is not what I'm talking about. A lot of women will have postpartum blues. So that is normal. You don't need to treat postpartum blues. I'm talking about individuals who notice the severity of the symptoms, and these symptoms are now starting to cause impairment in their day-to-day functioning after a baby has been born. That would be classified as postpartum depression. And again, I would strongly encourage individuals to go and talk to their physicians about that.
Dr. Singh, you mentioned some types of depression where someone should go seek some professional help. What do you recommend as the first step if they think they have some form of depression?
Since primary care physician is your entryway to the healthcare system, you usually have an established relationship with your primary care physician. That is where I would very strongly recommend that you start the process. Vast majority of primary care clinics have access to mental health professionals. They have social workers or therapists embedded within those clinics. And your primary care physician could refer you to one of these individuals who can then do a thorough assessment and determine your next level of care.
Once you've received a mental health diagnosis of depression, what does treatment typically look like for you?
So there are two kinds of treatment modalities that are generally used for depression. One is pharmacotherapy, which basically involves medication, and then psychological interventions, therapies have also been shown to be very, very effective, especially cognitive behavioral therapies have been shown to be very effective for depression. So you could choose either elements of the treatment process, or you could choose a combination of both. Studies usually support using a combination of pharmacotherapy with psychotherapy as being the most effective modality when it comes to treatment of depression.
Thank you, Dr. Singh. We appreciate you sharing your insight and knowledge regarding depression. And thank you to those of you who've taken the time to review our video series on how to identify and treat symptoms of depression. Thank you.